action.
Hi, my name is Michelle Sautner, and I'm a nurse practitioner student, and I will be doing a pediatric assessment on Nick here today. So I have Nick here. He's 14 years old, and he's in middle school, about to be in high school. He has no past medical history, and he has no allergies. His vital signs, which I took beforehand, were normal. His heart rate was 89, his blood pressure was 110/66, his temperature was 98, and his respiratory rate was 12. So hi Nick, we're going to be doing a bunch of tests on you today, on your muscles, on your bones, and on your brain. But first I need to get to know you a little bit better, okay?
Okay.
So could you tell me your full name?
Nicholas Lovera,
Okay, and could you tell me your date of birth?
November 2nd, 2010.
Very good. Can you tell me what grade you're in and what activities and sports you like to do?
I'm in 8th grade and I play a lot of basketball.
Okay, good. Could you tell me where we are right now?
My house.
Okay, and what's today's date?
March 7th, 2025.
There you go, awesome. So Nick was able to answer all my questions. He's alert and oriented ×3, and he's calm and he's appropriate for age. So we'll move on from here. We're now gonna test all of Nick's cranial nerves, 1 through 12. So we're gonna start with cranial nerve 1. That's the smell cranial nerve, and it's the olfactory. So I'm gonna have you close your eyes right now, and you're gonna smell something for me, and you're gonna tell me what it is. What do you smell?
Cinnamon.
Very good. Nick was able to identify that this was cinnamon, so his cranial nerve 1 is intact. Next, we're gonna do cranial nerve 2. That's the optic nerve. So basically, this is the visual acuity test. So I'll test the optic nerve by having you stand up, and I'm gonna have you walk down this way, 20 feet, and turn around. So over here, I have the Snellen eye chart. So I'm gonna have you first just read the smallest line that you possibly can with both of your eyes open. So for the most part, it should be this one. So could you read this line for me?
P-E-Z-O-L-O-F-T-U.
Okay, very good. Now I want you to cover one of your eyes for me. Okay, now I'm gonna point and you're gonna read.
P-E-Z-O-L-O-T-Y-U.
Okay, now switch and cover the other eye. Give yourself a second if you need it. Okay.
P-E-Z-O-L-O-T-Y-U.
Okay, so Nick's vision was 20/10. That's pretty normal. You could come back this way. If his vision was any worse, if it was 20/40, I would need to refer him to an ophthalmologist. But for now, he's good, so you can have a seat, okay? Next, I'm gonna test cranial nerve 3, 4, and 6. The 3rd is ocular motor, the 4th is trochlear, and the 6th is abducens. So I'm gonna check his pupillary responses. Basically, I take my pen light and I'm gonna shine them in his eyes. So just look over here, yep. Good. Good, so both eyes were brisk. His pupillary reaction was responsive, 3 brisk, okay? So that's normal. So the next thing I'm gonna have him do is basically follow my pen light. So I'm gonna have you look this way. Yep, just follow. And he's not moving his head. That's perfect. So that's the 6 cardinal gazes, and everything was normal. He had no deviations, there was no abnormalities. So that's a normal sign. And also there was no nystagmus, and he has full range of motion. So that's all within normal limits. All right, next I'm gonna test cranial nerve 5, which is trigeminal. So I'm gonna have Nick take one of his favorite snacks, and I'm basically just gonna watch him chew it. So go ahead and take a Tostito. Okay, and I'm watching basically to make sure that he could chew, that the motion of his jaw is smooth and even. His chewing is intact, and he's able also to swallow the snack. You good?
Dry.
Okay, don't worry, we'll fix that later. All right, next we're gonna do cranial nerve 7. This is the facial nerve. So Nick, I'm gonna ask you to make a bunch of silly faces, okay?
Okay.
So first, you're gonna smile. Good, now you're gonna puff out your cheeks. Next, stick out your tongue. Very good, and can you make an angry face with your eyebrows? Okay, and lastly, just frown. All right, very good. He did a great job. I was looking for facial symmetry and making sure that there were no droops on his face, that his eyes weren't lagging, everything was symmetrical, and there were no abnormal findings. So that was good. Next, we're gonna do cranial nerve number 8. That's the acoustic nerve. So normally I would do autometric testing, but we don't have access to that type of equipment here. So instead, we're gonna check vestibular balance. I'm gonna have you stand up, and I'm gonna have you close your eyes and just stand still. So I'm checking Nick's balance at this time, making sure there's no swaying, there's no movement. He doesn't have any issue, he's not swaying, he's not moving, so this is a normal finding, so he's good. His cranial nerve 8 is intact. Next, we're gonna do cranial nerve 9 and 10. That's glossopharyngeal and vagus. So basically, can you just say your name again?
Nicholas Lovera.
Awesome. So basically, I'm listening to his voice. He's able to talk to me easily. There's no issues. And I also heard at the beginning of the assessment with all of my questions that he was able to talk normally. There's no rasp, there's no whispering. Now I'm gonna have you sit down for a second. I'm gonna have you take a sip of water, which is gonna help you out with that last chip. Thirsty? Good. All right. So he was able to swallow easily. There was no choking and no difficulty, so that's a normal finding as well. Next, I'm gonna do cranial nerves 11 and 12. That's spinal accessory and hypoglossal. So I'm gonna have you stick out your tongue, and I'm gonna have you push against the spoon with your tongue, nice and hard. Good job. His tongue is strong and he's able to do that adequately. Next, I'm gonna have you turn your head from side to side. Very good. Now stop for a second. I want you to turn and push on my hand. Good. Now other way. Sorry, my hands are cold. Good. He has strengthened his neck. The next thing I'm gonna have him do is shrug your shoulders up. Try to go up. Good. And you put them down. So Nick has adequate strength in his shoulders as well. So this is all normal findings. Now we're gonna move on to the musculoskeletal exam. So I'm gonna basically be checking all your muscles and your bones now, and I'm gonna be looking for any skin abnormalities and any issues in your muscles like bruising, swelling, or scars. So I'm gonna touch you all around and just make sure I don't feel anything or see anything. Sorry again for my cold hands. All right, so no bony prominences. I don't see that there's any bruising on his legs. There's no swelling of any kind. Everything is within normal limits. Next, I'm gonna palpate again. I'm gonna palpate the muscles on your neck. I'm gonna see if you have any pain or tenderness. You're just gonna tell me if you do. So I kind of did palpation as I was doing both. So once again, same thing. Palpation and visually wise, he's totally normal. There's no abnormalities, tenderness, or any injuries, correct?
Yeah.
Okay, cool. Next, I'm gonna have you do some movement with your head. So I'm gonna have you look up, and look down, and look side, and to your other side. Good. Now put your arms all the way up in the air. Good job. Now all the way back and bend over your back a little bit. Good. Now I want you to put your elbows like this, and I want you to push up. Good. And now push down. Good. Next, I'm gonna have you put your hands up. Okay. Now push me. And push me in, or like bring your hands up. Good job. Nick is nice and strong. He was able to do that without any difficulties. Next, I'm gonna do kind of the same thing, but with your legs now. Push your legs up against me. One, you can do the other one. So with this, it's good to do it at the same time, just so I could feel both strengths. Good. Now I want you to push your feet up and point them down too, if you can. Yep, very good. So he has full range of motion. He has no pain, no tenderness again. His extremities are all strong. So that's a normal finding. Next, I'm gonna have Nick stand up, and I'm gonna have you walk over this way. Go all the way to the end where I had you for the other visual test. Okay, I'm gonna have you walk a couple times. So I want you to walk normally to the wall. Very good. Now you're gonna walk back and you're gonna walk on your tippy toes. He has full balance. His gait is steady and regular. Now I want you to come out a little bit just into the light. And I want you to squat down and stand up nice and tall. Good. Now you're gonna come over here for me and turn around to the side for me, all the way. I'm basically doing a scoliosis check, so bend down to your legs. Okay, so I'm feeling for bony prominences in his back. Everything seems normal. His hips are even and no signs of scoliosis either. Okay, you could sit down. Oh, sorry, stand up again. You're gonna do the hops test now, so I want you to hop with both feet. Good, now hop on one leg. Now hop on the other leg. Nick was able to do that, no issues, so his balance is good, his strength is good in his legs. These are all normal findings, okay? Next, we're gonna do the Romberg test. So you're gonna stand with both your arms to the side like this, yep, and I want you to close your eyes. He's able to do this. This is similar to a test I did before, but we're basically just looking for abnormalities in balance or swaying. He's totally fine, so this is a negative Romberg test, okay, and a normal finding. Next, we're gonna do pronator drift. You could sit down. Very good. I want you to hold your hands up and like you're holding a pizza tray above your head. Okay, good. Now keep your arms there and close your eyes. 1, 2, 3, 4, 5. So I'm basically just seeing if Nick's hands drifted down. They didn't, you can put your arms down. If his arms were to drift down, that would be a sign of a neurological deficit. Since there is none, he has a normal finding. Usually with neurological deficits, it could be something like a stroke, a mass, or something affecting his neural system that would make him drift down. But he didn't, so that's normal. Next, we're gonna do the finger to nose test. So you're gonna take your finger and you're gonna touch it to your nose. You're gonna do it with the other hand too. Very good, now close your eyes and do the same thing, finger to nose. Now the other hand, good. You could open your eyes. He was able to do that without any difficulty. Now I want you to touch one finger to your nose. And now I want you to touch my hand. Nose, hand, nose, hand. Good, now do it with the other side. Hand, nose, hand, nose, hand. Good, he has no spatial awareness deficit, and this is a normal finding. He was able to do both sides without any difficulty. Next, we're gonna do rapid alternating movements. So basically, I want you to pat your thighs and flip them over. Now do it again. Keep going and make it as fast as you can. Good, you could stop. So he was able to do that. He had full coordination in doing the rapid movements, so this is a normal finding as well. Next, we're gonna do heel to shin test. So I want you to stick out this one leg, and I want you to take your other leg with your foot and basically take it and slide it along your leg, all the way down. Good. Do it again. Okay, now do it on the other side. Very good. All right, awesome. So he was able to do that, no problem. It was smooth, he had coordination, so this is a normal finding as well. All right, next we're gonna do sensory test. This is for exteroceptive perception. So close your eyes, and I'm going to ask you if I'm touching you with something hard or with something soft, okay? Am I touching you with something hard or soft?
Soft.
This is soft? That's okay, we're gonna try it with a different object and see, okay? All right, what am I touching?
Hard.
Okay, very good. And then, let me find something. Keep your eyes closed, okay? Am I touching you with something hard or something soft?
Soft.
Very good. Now I'm also gonna do one more. Just tell me if it's soft or sharp.
Not sharp.
It's sharp, okay? That one's kind of hard unless you're using the exact thing. So he did a good job anyway. All right, next we're gonna test temperature. So I want you to close your eyes and you're gonna tell me if the object I'm bringing out is hot or cold, okay?
Cold.
Very good. He was able to identify that the ice cream was cold. Put that back. Okay, next we're gonna do sensory proprioceptive perception. So keep your eyes open and put your hand out. And basically I'm gonna take your finger and I'm gonna tell you this is up and this is down.
Okay.
Okay? Now close your eyes.
Down. Up.
Good. Nick was able to properly tell me which is up and which is down with his eyes closed, so this is a normal finding. Next, we're going to do graphesthesia. So I want you to put your hand out, and I'm going to draw a letter, an object, something. You're going to tell me what it is, okay? Close your eyes. What?
Circle.
Yes, he was able to properly identify that I drew a circle in his hand, so that's a normal finding. Next, we're going to do the vibratory sense. So for this, I'm going to use a tuning fork. If you've never seen a tuning fork before, this is a tuning fork. So I'm going to hit it, and I want you to feel what the vibration feels like, okay? Well, actually, it stops. I want you to put your hand out, okay? So like almost like just touch it when I bring it over, okay? Oh, I stopped there too. Okay, so now you know what it feels like? Okay, I want you to close your eyes. And we're going to do it again, and you're going to tell me when the vibration stops, okay?
Stop.
Good. He was able to discriminate the vibratory sensation, and he was able to distinguish when it was over as well, so this is a normal finding. Next, we're going to do stereogenesis. Basically, this is able to identify different objects. So close your eyes, and I'm going to put something in your hand, and you're going to tell me what it is, okay?
Rubber band.
Very good. Nick was able to identify the rubber band with his eyes closed. This is a normal finding. Next, we're going to do 2-point discrimination. So basically, put your hand out and close your eyes again. And tell me if you feel 1 or 2 points in your hands.
2.
I'm just going to do it to 1, and then it's easier.
1.
Okay.
2.
Okay.
2. 1.
Very good. He was able to distinguish senses on both of his hands. Next, we're going to do the deep tendon reflexes. So I'm going to use my trusty tool. I'm going to do your bicep muscle first. So he was able, I saw him use flexion in his forearm. So this is a normal finding. That was 2+. Next, we're going to do brachioradialis. I was able to see his hands move. And there was flexion of the elbow and pronation of his arm, so that's a normal finding. Next, I want you to put your hand like, kind of like this, like a dead weight almost, like that, yeah. Okay, I'm gonna hit. I was able to see the reflex of that. I hit right above there. I saw flexion of the arm. Next, it's kind of hard because he's pretty tall, so for the patellar one, I would usually have a person kind of dangle their leg over and I would hit. He's just taller, so we're going to do it for faking sakes. I would have hit here and his foot would have gone out. Just too hard with that. Next, we're gonna do the Achilles, and I'm gonna hit it. And I was able to see the plantar response. That's a normal finding. So all reflexes were too brisk, and that's normal. There's also the superficial cremaster reflex. We are not gonna do that here. That's something that you usually do on a baby. So with that test, I would stroke the inside of the thigh, and the cremaster muscle would contract and pull up the ipsilateral testicle. So we don't need to do that here today. So we've come to the end of our assessment actually. For this patient, Nick, I would choose the patient's ICD-10 code. And for him, I would choose Z00129, which basically stands for a routine child health examination without abnormal findings. Everything in this assessment was pretty much normal. Nick's a healthy, young 14-year-old male. He's doing really good. The only thing I'm gonna add is some anticipatory guidance for you in the future as you move through high school and on. So you should be brushing your teeth twice a day and flossing at least once a day. You should try to limit your TV screen time, video games to 2 hours a day, excluding homework, of course. Always wear your seatbelt in a car. And also if you're doing any sports, wear protective gear like helmets, whether you're riding a bike, whether you're skating or skateboarding, and always say no to drugs or alcohol, okay? So this is the end of my musculoskeletal assessment, and thank you so much, Nick.
Oh.
Okay.